Today, we're going to dive into a topic that affects millions of people. What is hemorrhoid artery embolization?
We find the vessels that are feeding the hemorrhoids in the anus and rectum, and we're able to slow and stop the blood flow that's feeding the hemorrhoids.
What symptoms should patients pay attention to?
Common symptoms are painless rectal bleeding.
Can someone have this done on a Monday and go back to work that week?
The day after the procedure is pretty much back to normal activities. Don't be embarrassed about having hemorrhoids. We see all ages that have this medical issue.
Hi, everyone. Welcome back to the OBL and ASC Marketing Blueprint brought to you by Patient Pro Marketing. I'm Rachel Biesinger, and today we're going to dive into a topic that affects millions of people that still isn't really talked about enough: hemorrhoids. I'm joined here today by Dr. Ryan Armstrong with the Texas Endovascular in Houston to discuss why this condition is so common, why so many patients delay treatment, and how newer minimally invasive options like hemorrhoid artery embolization, or HAE, are changing the conversation around this care. Thanks, Dr. Armstrong, for joining me today.
Hi, thanks for having me.
I'm really excited to talk about this. I know that sounds kind of weird, but I think it's a personal issue. I've done a lot of interviews with a lot of your partners already regarding MSK embolizations, and I feel like this particular topic is very personal and most patients are uncomfortable talking about it. So I appreciate you being here today. Can you tell us a little bit about your background and how you became interested in treating symptoms or conditions like hemorrhoids with HAE?
So I'm an interventional radiologist, specialize in minimally invasive image-guided procedures. We do a number of procedures involving the blood vessels in and around the body. And treating these type of conditions, began hearing stories and hearing at the lectures about people treating internal hemorrhoids using embolization procedure about 5 years ago, and hearing the great success they were having and helping these underserved patients that don't necessarily have other good options for such a problematic condition as the internal hemorrhoids. So we began focusing on developing it in our practice about 3 to 4 years ago, and had a lot of success, and it's been very rewarding being able to help these type of patients.
Can you share with everyone what is hemorrhoid artery embolization exactly?
So it's a procedure in which we find the vessels that are feeding the hemorrhoids in the anus and rectum, and we're able to slow and stop the blood flow that's feeding the hemorrhoids that causes that tissue to expand and can cause the bleeding symptoms and the prolapse symptoms. So we prevent the blood from reaching that tissue and help the body heal on its own. Other options for treatment that are available include surgeries in which the surgeon ties off the blood vessel, but requires an incision from the anus in order to reach that blood vessel and tie it off. We're able to tie it off from the inside of the blood vessel without having to make any incision. So it's a much more minimally invasive technique. It's a much easier recovery period and has similar results as surgical ligation.
Okay, but the procedure itself is a lot less invasive. You mentioned
Exactly.
with banding, there's incisions, there's cutting. How exactly do you access internally?
Yeah, that's a good question. So we get into the blood vessel, usually either through the wrist, the vessel in the wrist, or the vessel in the groin, and we're able to direct that catheter under x-ray guidance to the vessels feeding the hemorrhoids in the rectum. So there's only a small puncture at the site where we get into the vessel, and that's the only break in the skin that's made.
It's pretty amazing to see any of those type of procedures compared to the traditional treatments that are out there. Now, you mentioned like surgery. I know some patients are told like sitz baths and banding and...
True. So the treatment buckets include conservative measures such as sitz baths, topical ointments, foam ointments that can help with the inflammation associated with hemorrhoids and decrease swelling. Beyond that, more invasive treatment options include endoscopic banding, in which a proceduralist is able to place a rubber band by going through the rectum and placing a rubber band around the expanded tissue. So it still involves manipulating on the inside there of the rectum. And it can be a painful recovery. And unfortunately, endoscopic banding has a 50% recurrence rate at a year. So a lot of patients that we see have attempted that treatment already and it hadn't worked. Beyond that, there's also surgical ligation, which I mentioned, which the surgeon ties the vessels off. There's other surgical techniques in which they excise the tissue and block, meaning they go in and they cut out that whole section of tissue itself, vessel and tissue. That requires a major recovery. So a lot of patients want to avoid that type of situation and are happy to give HAE a try before going down those paths.
I've known a couple of people personally that have had the banding, and they've said it's just absolutely terrible. Like they would never, ever sign up to do that treatment again. So for someone who doesn't really know, because you're talking about internal hemorrhoids, right?
Sure.
What symptoms should patients pay attention to?
So there are kind of two varieties of hemorrhoids, and we're talking about the internal hemorrhoids versus the other variety is external hemorrhoids. Internal hemorrhoids lie more deep within the pelvis and the rectum, and common symptoms are painless rectal bleeding, or blood in the toilet, blood on the tissue paper after you go to the restroom. The tissue that expands can protrude outside the anus at times and sometimes requires manual reduction, meaning to be pushed back in by patients. So that's a very uncomfortable scenario. Pain is not typically associated with internal hemorrhoids, although they can become inflamed and stretched out. That's opposed to the external variety, which are more characterized by pain, itching, discomfort.
What causes hemorrhoids, especially the internal hemorrhoids?
So the hemorrhoid tissue is a natural tissue that is purpose is for fecal continence, or to help us keep our bowels inside. There are certain situations that cause that tissue to abnormally expand, and it's mostly thought to be to increase pressures in the vein side that's straining it. And that can happen in a number of situations, including constipation. If someone's straining a lot while going to the bathroom, can cause that tissue to expand. Pregnancy creates a whole new hemodynamic situation in the belly, and you've got a 20-pound rock sitting on those veins that drain the pelvis. That's certainly a big risk factor. There's also believed to be some genetic components kind of born with it that cause that to just be more susceptible to dilating the tissue. Other behaviors include sitting on the toilet for too long. So we encourage patients not to scroll Instagram for too long. Exactly. So primary treatment, including the conservative measures, include stool softeners and just more regular bowel habits and being more mindful about time on the toilet.
I'm glad you brought up the phone, because I spoke with another provider. I asked him, like, when did we start seeing the change or increase in this? And he's like, social media, phone scrolling, like people, their bathroom habits, right? That's a big component to increase in patients with this condition. You mentioned like stool softeners and some of the preventative stuff. At what point should a patient, if they've tried sitz baths, they've done stool softeners, at what point should they seek evaluation from a preventative?
First onset of rectal bleeding, when you see blood in the toilet, that should be evaluated rather soon, because there are a number of other issues, including cancer, that can cause blood in the stool. You want that ruled out first. Thorough colonoscopy to evaluate to make sure that there's nothing else causing it in the diagnosed hemorrhoids. Typically, after that point, conservative measures are attempted. If the bleeding and symptoms from known hemorrhoids continues and becomes more frequent, that it's altering your daily life, your ability to enjoy work and normal activities, that's when it's time to do something more aggressive rather than the conservative measures. So
Yeah.
That's when we come in and we can offer the HAE.
Okay. So do you suggest then, if someone's just at the beginning of this journey, let's say they just went to the restroom, they noticed blood, they go to like a primary care or a gastro physician before coming to see you?
That's usually the best first step. Undiagnosed hemorrhoids with blood in the stool needs to be evaluated with a colonoscopy. That's typically done by a gastroenterologist.
Okay. And that's to rule out cancer or anything other than possibly an internal hemorrhoid. Then
Correct.
they could come see you and see if that would be an option for HAE.
Correct.
I think we kind of know who the candidates are. I do have a question though. Is there does this affect mostly older people, middle-aged people?
The perception is that it's just old people, but we see people in their 30s and 40s midlife very frequently, especially women after having children, unfortunately, and also men in their 40s that have been very active lifestyle otherwise, but it can really affect anybody.
Can they go away? Like if you have them, you kind of don't treat them, you have some symptoms, but then the symptoms stop. Can the internal hemorrhoids just go away?
Some people do have a response where they'll regress intermittently, that change in their bowel habits or change in their lifestyle, change in their diet, and they can be improved. In some people, that may be all it takes. In other people, they can progress and be problematic. But they do tend to flare up, so to speak, in most people from time to time. It can be a kind of a vicious cycle when they get bad, and it makes people not want to go to the bathroom, and then they get more constipated, and it causes the hemorrhoids to be further worse.
That's just like the domino effect, right? So if somebody wanted to come in for an evaluation for HAE, and we get asked this a lot, what should they expect on the exam, right? Like when they come in to speak with you. And then if you could also let us know, once they have the procedure, what is the recovery like for them?
Well, when we see a patient for HAE, we go through their history to find out how long they've had the symptoms and exactly what the symptoms are, what evaluations they've had in the past, and if any colonoscopy reports, we go through those. After the procedure, bleeding symptoms usually resolve the soonest and are the most responsive to the treatment, and they typically improve within the month. It can take a couple weeks for symptoms to improve as that tissue decompresses after the procedure, but we expect fairly after that complete resolution of bleeding symptoms and durability for 2 to 3 years on the vast majority of cases, which means that they can recur, unfortunately. And when they do recur, they can be retreated in the same way or any other way available at that time.
Onset recovery, though, can someone have this done on a Monday and go back to work that week? Or
Oh, that's a big advantage. Yes. Yeah. After the day after the procedure is pretty much back to normal activities.
the day after?
The day after.
Wow.
Yeah. There can be some mild rectal irritation, but nothing that's very limiting, doesn't require narcotic pain medication or significant recovery time. So,
Yeah, I think that's really important to make sure everyone that watches this hears, right? Or the benefits
absolutely.
of how quick the recovery is. You can get back to work right away. No incisions, no cutting. And this is all done outpatient, right? In your facility.
That's right. That's right. Yeah. Same day procedure takes about an hour. After recovering from sedation for an hour, you go home.
I think that's so awesome. That's what I love about the OBL space so much is the access patients have where they can literally have a minimally invasive procedure like this, in and out, go home and go back to work the next day. Like it's great. Is there anything else about HAE that you'd like to share with somebody?
Studies have shown that it's equally as effective as the surgical therapies, but it, like we were talking about, has minimal recovery and minimal incision and back to normal activities right away. Cases when someone has internal hemorrhoids and they're weighing their options, it's a great first option to attempt.
That's a great thing to say, because if they have HAE done and can they have other procedures if needed?
Fortunately, no procedure is 100%. While HAE is about 80% effective, no procedure that available is 100%. Should it not work, it can be reattempted, but all the other options are still available down the road.
Yeah, that's what I like about it. It's not a permanent thing. It's if you still needed to have whatever the next step is, you could. So Dr. Armstrong, if somebody is too embarrassed to seek care out there, what do you have to say to them right now about this?
Don't be embarrassed about having hemorrhoids. We see all ages that have this medical issue, and that there are options available for you to help.
Yeah, great. And I know they can find you at texaseva.com.
That's right. Mm-hmm.
Yeah. And you guys have how many locations in Houston?
5 locations in the greater Houston area.
Okay, great. Are you at all 5?
I'm at the Woodlands area and Sugarland location.
Okay. So Sugarland, Woodlands, everybody. Look them up. texaseva.com. Thank you so much, Dr. Armstrong.
Thanks, Rachel.
For your time today. I appreciate you.
All right. Thank you.